I'd like to welcome our next speaker. We've been known to say that in an information-rich world, context is critical and insight is invaluable. So to the stage now for this next talk on turning data into insights, we'll welcome Mr. Balaji.
Thank you very much for that. Good morning. Good morning. So first of all, I thank the committee to when they reached out to me to come here and speak to you about about what we are doing at BayCare. I was a little hesitant. I wasn't sure what I was going to contribute, and then they brought in the context to the picture in terms of sharing and learning in terms of what we have done, how we can learn from what we have done, and what you have in your side that we can learn from. And then I thought, that is very good, right? So that goes back to what Arnie was talking about earlier, to see, giving back to the community or learning from them, things like that. So with that, I want to get started on this. So one of the things I want to kind of continue from what Arnie was talking about earlier about the technology and the innovation. All the things are great, but how do you quantify what you want to do and bringing some insights and reality to it, right? You have a nice opinion and everything in terms of what we want to do and how we want to do it, when you want to do it. But what is driving that? What is the fact behind it? So that's where I wanted to bring up some of the things what we have done at BayCare. Quickly, if I find how to operate this. Oh, yeah, thank you. Some technical difficulty. So, oh, I wasn't connected. Sorry about that. So, quick introduction, I'm Apparsamy Balaji, like I was talking about earlier. To make it easier, I go by the name Balaji, and I'm heading the data program. Thank you. I'm heading the data management program at BayCare. So, quick agenda in terms of trying to share what was our vision when we originally started that day one, and then what we have done so far, and how we did that is the main portion that I want to focus on, and also what's in store for the next few years, right? How many of you know BayCare here? Or not know BayCare, let's say? Haven't heard about BayCare? Oh, wow, okay. So at least I have some information for the few folks here, right? So where to start, or how to start the presentation about data and analytics without numbers, right? So we wanted to start off with numbers in terms of BayCare. We are about 15 hospitals across 4 county areas. We have 380 access points for the patients. That doesn't include the telemedicine program that we have in place. We have over 3,500. Is that 3,500 beds? Yep. 3,500 beds across all our hospitals. We have over 25,000 team members strong, and everybody is contributing and working towards the making the health system better, and also getting the community healthier. 5,200 physicians who are in our network with various affiliations, from employed physicians to affiliated physicians, contracted physicians, and so on and so forth in our network. We're about $4 billion company annually, and we are growing. When I joined about 5 years back, we were about little less than 3 billion. Now we are about 4 billion. So that speaks volume. And we are heavily invested on the community. So we bring a lot of things back to the community. So it used to be about $200 million that we bring back to the community. Now we are about 390 million back to the community from last year. And few other numbers in terms of our volume. So the total number of births, how many admissions we had, and so on and so forth. So that's a quick hit on the healthcare. So first start off with the vision, right? So when we started the whole thing about 5 years back, the idea was, what is that we are going to do and why we are trying to do that, right? So the bottom line is to create the data or promote the data as an asset for the company. We have been dealing with all the media things from the Facebook, having our data, the Cambridge Analytica, that what our, presidential board is using and all the stuff, which is very interesting, right? So that's the information that is going to be treated as an asset for the organization. At that time, many people did not believe in this within the organization, say, what do you mean by data as an asset, right? So we said, let's leave that aside. Tell us what are your current challenges, and we will figure out how to best take care of those issues. And one of the things is the timeliness of the information that gets to the hand. They used to get all the annual reports and everything else, but we were making it much faster, much better in terms of the interactiveness and the readiness and the consistency and everything else. How did we do this? So the strategy behind getting all the stuff is to build a single source of truth. So if you go in any organization and ask a question, or large organization like BayCare, you ask the same question, you consistently get different answers from different groups. So we wanted to avoid that and say, if you ask the question in any part of the organization, in any department, and any time, you should be able to come to the same answers. And that's one of the main things. And then within healthcare, we were talking about the phones and the different connected devices, right? So when you're talking about all the different devices, you get the information, but you need to integrate that information so it is focused on a single person. So that the integration of information is very, very important. And the other part is the standardization of that information, right? So as an example, how many physicians we have in the house here today? Only one. Oh, well, there you go. Perfect. Good. Okay, so we have good BayCare presence also. So the challenge is when you ask the question, we ask simple metrics as, what's the average length of stay within our system, right? And what do you mean by length of stay? Are you talking about the midnight census? Are you talking about the 24 hours day? Are you talking about the number of hours and the accumulation of that? So those kind of variations we wanted to eliminate, and that's where the standardization was big, critical component for the organization, right? And then the ability to answer the complex business question are the fundamental in terms of how we did that. So I have a couple of my team members here who helped me in this, in this whole thing, in the journey of the analytics program at BayCare. And we helped to build this whole infrastructure or the platform to be able to answer the complex questions, not necessarily the simple things what we normally get as straightforward reports. I wanted to bring some value proposition in terms of what we have done within BayCare. So everything what we have done is focused on the 4 key things. First thing is quality is number 1 for our CEO, for our overall health system. Quality of service, quality of interaction, quality of everything what we do is very, very important. The second thing is physicians, right? So physicians are the core for the systems. Right? So you're good. We're all good. So without physicians, we can't do anything in the healthcare. So the physicians, to be able to help with them in terms of what's the quality of service they provide, and also what is their operations that impact the bottom line. The happier physicians, better health system, right? And then patients. We need to take care about all the patients. So every patient comes in, we want to make sure they are getting healthier and better when they leave the system. And but like every other organization, cost is the bottom line, so reducing the cost. Along these lines, I just wanted to highlight a few things that what we have done. One of the things is we built some analytics program around our urgent care. About 3 years back, we had 2 urgent care settings within the Tampa Bay area. Today, we have 12. So we grow very rapidly around that, and the idea behind that is to be able to get the access points much easier to the patients, and for patients in the focus, right? So how instead of going to the ED, instead of going to wait for your physicians, you can get somewhere in between to go to the urgent care and do this. In order to make those urgent care settings much efficient and useful for the community, we had to put some measures around it. Right, focused on the operational things in terms of how effective they are in seeing the patients, how long the patients are waiting, how many physicians we have, how many caretakers we have, whether they are providing the right service at the right time and all the stuff, and also measure the key things around the patients are coming out and not getting admitted. So also we were able to measure is these urgent care settings at the different neighborhoods are acting as the intake channel for our overall system. Meaning, if I'm Apparsamy Balaji, I go to an urgent care center to be able to find I'm a net new patient for BayCare, right? And then following that, did I go back to BayCare again? right? Is there any kind of relation between why I went to the urgent care and then why I went back to the hospital or to the physician, right? Is it related to the diagnosis I have, or is it because of my experience? Those are the things that we were able to measure and bring it back to the urgent care settings to make it much more effective to provide better service as well as patient care and everything else for the organization from the bottom line, like I said, the financial things. Second thing, surgical analytics, right? So we all know the surgery room is not the favorite place for everybody, right? Including the physicians or the surgeons. So we did a lot of study on that to be able to look at the turnaround time, the patient in and out time, how effectively we are using those facility, how effectively we are using the resources within those rooms, and what's the avoiding the wastage, right? So we got a Six Sigma program into place to be able to measure the lean. Use the lean to measure the waste and all the stuff to do that. And then revenue cycle metrics, right, without revenue. So this is the place where we are looking into the overall core finance operations around how we are managing our ARs, APs, right, the aging of those things, improving the cash flow, getting those things in there, cash in hand as much as possible to kind of put ourselves in a better position. Physician services. So this is one of the huge things that we have done. So everything what we are doing around patient and physician. So in this case, focusing on the physicians to be able to see what kind of processes that they are following, their practice patterns, and the effectiveness of that, how it is impacting the bottom line. Right? So if you're taking an example of a particular physician, if you look for a specific diagnosis, if I'm Dr. A and if the 10 patients comes to me for flu, what kind of diagnosis, what kind of orders I place, how I am different from other physicians. Most importantly, connect that to the outcome, right? Am I getting better or am I getting readmitted? Those kind of things are what we are able to derive to this. And then value-based purchasing, right? So this is one of the things, the Medicare spending per beneficiary in terms of what is the opportunities for our revenue that is kind of leaking at this time, going to other systems or outside of BayCare. We wanted to focus on that to see how effectively we can do that, and also the efficiency of various physicians ordering labs, tests that may or may not be appropriate. So we were able to collect that information to bring it back to the the physician themselves to to create visibility to kind of change in the behavior and use the best practices in place. Med staff, that's another piece that's focused on the physician again. So this is all about the quality of the physician. So focused on individuals, physicians, their specialties, their practice groups, and looking at their core quality metrics like the length of stay, the mortality, morbidity, and all the stuff that we wanted to make sure we bring it in front of the physicians so they can easily look at this to support their incentive as well as how to elevate one compared to the other, right? And emergency department, we all don't want to be there, but the thing is, when the cases that where we happen to be there, how was our experience, right? We go in there with very acute pain or some real discomfort, but we were put out to wait. And that's one of the main things we are trying to not to have that experience. How do you measure that? From the time you are getting registered until your first triage, and then until the physician comes and sees you, diagnosis, treatment, in every stage, how long does it take? What can we do to reduce those things, to improve the care as well as reduce the pain, improving the overall improving the patient experience? Those are the things we wanted to bring up in light. We have 700,000 visits per year in the ED across our system. So that's, in terms of volume, that's huge. That's the place where we wanted to focus more and then bring the right information or creating the insight to be able to help with that. Length of stay and readmissions. If you are following the news in the recent times, many focus on the length of stay. How to look at the length of stay, how do we reduce it, and the readmissions, right? People getting readmitted. And for readmissions, Medicare said, if you are getting readmitted, we are not going to pay for it, right? And so we want to look at it, in several different ways, how to kind of get ourselves out of those risks and also focus on the right things for the patients. Length of stay, we did some of the things around saying, for the patients in terms of, what is their dissatisfaction about length of stay. The doctor told me that I can go at 10 o'clock, but it's 2 p.m., I'm still here. What's going on, right? So we were able to associate the discharges with respect to the shift changes around 11 a.m., before 11 a.m., after 11 a.m., what's the trend, what is happening, why that is not happening. We were able to bring a lot of insights to the facility so that they can reduce the length of stay. Even a couple of hours for each discharges, adds up, and that's a huge thing for this organization. Readmissions, again, a big thing in terms of when you get readmitted, the payers are not ready to pay for those, readmissions. So we wanted to say when the patients get discharged, what other things needs to be taken care of in terms of during the discharges, after the discharge, and then follow-up calls and all the stuff. So those are the things we were able to bring in terms of specific data points. Data services is one of the major things. That's basically, a service that we have that is, if any of our external vendors and partners or regulatory boards needs information for study analysis and also for the compliance, we were able to do that quickly. Earlier it used to be, oh, you need data? Okay, wait, I will get to you in 2 weeks' time. Now it's not like that. We made cookie molds of several data sections so that if you need the information, it gets there in matter of hours or, worst case, days. Productive and operational analytics. So the productivity is one of the key things. As I mentioned earlier, we are about 27,000 people in the company. So measuring the productivity is one of the key things. Nurses, combined bring about 16, 17,000 in that 27,000. So looking at the productivity around nurses is huge in terms of their shifts, their overtimes, how we are getting the nurse pool from the contractors, how that is affecting the bottom line in terms of dollars, and also sometimes the overtime is impacting the quality of service, right? Patient dissatisfaction. So human, as we are growing, fatigue and all the stuff, that reflects on the service that we provide. So we brought in all those things into light. Operational things across the organization, every service line that we have, right? We have several service lines, from ambulatory services to outpatient imaging to surgery centers, ED, urgent care. Every service center, service lines that we have, every one of them needs operational efficiencies and looking at the opportunities to improve on that. Starting from turnaround time, wait times, every stage of the processes, how we can shrink those things. What is actually causing those things to happen? Cost per case analysis. This is one of the huge things that we have. And basically, if you take a specific diagnosis for hip replacement or sepsis or something like that, you can look at what's the average cost for that particular thing in the system. And you should be able to see for each hospital what's the average cost. So you can create a spectrum of this in single view and look at it saying, hospital A is costing about $800. Hospital T on the end is costing about $3,000. What's the variation and what's everything in between? Who's the best performer in this? What's the best care, best practice that we want to move the needle towards right or towards left? And then there are several arguments comes into that saying, oh, they don't care about the patient. They just quickly want to get rid of the patient. That's the reason they are low, right? So to add more substance and facts to that, we were able to provide information saying, in this hospital, here is the physician group. And each physician group, what's their average cost? You have the visibility right then and there to be able to look at it and say, where does it fall, right? And then say, some physician groups are doing better, some are not necessarily all that great, but you can drill down to the physician group and look at the individual physicians, which physician is actually costing more or less, right? It's not only based on the cost, you look at the cost and say, okay, here's $800 per average cost for this diagnosis. And then you can tie it to that, what's the length of stay for that, average length of stay? What's the outcome in terms of the patient satisfaction, the pain scale measurement, and everything else around it, so that you can tie that and justify, say, okay, even though you are $800, your dissatisfaction with the patient is so high, so we need to not necessarily be in that realm. We need to move you where it is a balance between the cost and the quality. So The idea behind all the stuff is to be able to present this information for BayCare, like I was talking about the core values we are talking about, and bring it as a actionable BI, actionable business intelligence, right? So everything what we are talking about here is bringing the service line leaders, other process owners, to be able to give them the insights about where is the challenge or what they perceive as the challenge right now, and what are the possibilities that we can balance the whole thing. All right, so next thing, one of the things is building the competitive advantage for BayCare, right? So it's not about just to build the reports and providing data. It's about saying helping the system to answer the complex questions. Like I was talking about earlier, the overtime policies, right? Constantly we rewrite the overtime policies. While rewriting the overtime policies, we wanted to provide insights and data to that, saying how it is impacting the quality of service or the patient satisfaction. So that data actually plays a part in writing the policies, right? And that's very huge in terms of what it is. And then the other thing is on the cancer registry stuff that what we have done, we were able to move the threshold to find out which is actually the right threshold to do certain diagnosis or tests and things like that. Cardiovascular, right? That's one of the things that's huge in the healthcare industry in terms of the revenue generation. Cardiovascular is major. In that, the reimbursement is something that we have been working on. Every initiative that we are working on the reimbursement to improve on that, we don't want to compromise on the quality, so we should be able to see both the reimbursement and the quality on the same scale and figure out what works the best to strike the right balance in that. About the millennials. So there's a lot of things going on in terms of debatable opinion about that, which is saying the millennials are not getting their kids soon or maybe delaying that process. So what is the impact of that opinion to the bottom line of the company in terms of specific service line for the number of admissions, for the number of deliveries, and what's the operational facts around the OB and the, labor and delivery and everything else. So that's, again, a huge thing. This is one of the things, in terms of the payer mix changes, what happened in the recent years, how it is impacting our credit rating, right? So that's huge, and then we were able to, put some kind of numbers around us to present a very, very valid argument or a statement in front of the leadership and the executives and say, this is why we shouldn't do that or we should do this, right? So that's one of the key things. And so far in terms of what we have done for BayCare, now it's coming to saying how we did that. Again, the main thing is information. When you're talking about, when Arnie was talking about all the connected devices and everything, in the mid-90s we had that's a century of engines. And then in the late 90s and the beginning of the 20th century, that was the century of computers. Now it's a century of devices. What it means is it's basically producing a whole bunch of data. So more and more focus is coming to the data because we are trying to utilize the data to understand the behavior and the changes in behavior and how we can change their behavior. In order to get all the data and everything, it's, interfaces and other key things, right? So here, with that in focus, we are bringing all the information from various service lines. So you can see when you're talking about patients and the organization, starting from scheduling your appointment, getting into the registration, going and seeing the physicians, the diagnosis, what's happening in the clinical systems, and after your discharge, what's going on with the billing, coding, and everything else, how the revenue is realized, how we are submitting the claims, and what's happening within the organization in terms of the enterprise resource planning about finance, supply chain, human resources, all the information we are bringing it in one place. What it means, it's not just throwing all the information in one place, it's integrating. That is the key differentiator. So at any point of time, if you're talking about taking a patient, we can build a lineage for the patient and get a 360 view. Meaning, if you pull up Apparsamy Balaji's record, you can see how many encounters I had within BayCare. Not only within our hospital, not in urgent care, not in the physician office, not in the ambulatory services, but everywhere. So we can get a clear view about what happened in our system. We are adding to it even if you go outside of our system, can we bring that in? So you can, in one single view, you can see, is he a chronic patient or not necessarily that, right? So that's one of the key things to be able to build on that. And the same way, I want to flip the other side and say physician side. You take Apparsamy Balaji as a physician and see how many patients he has seen. What are the case mix index for those patients? What's the length of stay for those things? By the diagnosis, right? And everything else from the quality to the bottom line in terms of the financial operations, what's happening there, those are the key things. So this data platform, what we have created, the single source of truth I was talking about, was able to provide those two views in a very easy manner, right? So this is all great in terms of having the data. I'm pretty sure nobody wants to look at the Excel sheet with multiple columns of data back and forth. So what we have done is to visualize the data, we wanted to create a delivery platform. So we have a delivery platform which basically driven by the core values of saying it should be easy to access, easy to understand, and readily available, and most importantly, 100% interactive. Meaning, like I was talking about a little earlier, you can look at a specific disease and look at what's the cost, average cost for that across the system. And then you can look at it, what's the average cost for that specific disease at the individual hospitals. And then drill down detail into the thing, for this particular facility, what's the average cost for the physician groups, or the practice groups we are talking about. And then for the individual physicians, and for the individual stay at the hospital, and each day of this stay. And then look at this, in each day, how much orders or costs associated to the stay focused on labs, images, and medication. So all those things without touching the keyboard. So that's the main objective behind providing that delivery platform. So the convenience and the comfort of using that information is very, very key. That's the reason the delivery platform is important for all the stuff. So few things, instead of going into a lot of details, I wanted to share in terms of what are the major things that contributed to the success, right? One is strong team, right? Always look at this saying, we can come up with a big idea in terms of what it is and how we want to do it. And, the strategy is great, the vision is great, the strategy makes sense. Who's going to do that, right? So I always believe in hiring smarter people than me. So I got a couple of people in the back of the room who is part of my team, used to be part of my team. And they made the whole thing happen. And one of the key things I want to share is it's, the reason for our success or the way or the place where we are right now is because of the people who are part of my team. And 80 or 90% of the team members that joined my team are basically from the same organization. So which we didn't even hire from outside because they bring a lot of information. The intellectual property that they carry is huge. So they came into the group with a lot of enthusiasm and made a whole lot of difference. And then second thing is agility, right? So that's one of the key things. When in the history is basically you ask for certain information or a report, you had to wait for 3 months or 6 months, and then we'll get to it. Now we created that whole agility in place to be able to say, you will get it in a couple of weeks, and then iterative process after that. Strong and engaging governance. Nothing in the industry goes without the support of top down. So we got the executives right on the track, focused on the right things, and their help to do this. Focus on the validation. One of the key things is that the whole thing in terms of the success, this is the key factor for that, which is if you're looking at the information, the first thing is every dashboard we provide is directly or indirectly communicating bad news for certain people. So their immediate reaction is, your data is wrong, right? So what do we do? So that could be a big downfall in this whole thing. So we focused at the early stages on validation and reconciliation of the data, what we pull in there. So down the line, that question never comes up, right? So it comes up from EDW, everybody say, oh, that's good, because their group has already looked at the data and reconciled and validated that. And we established this as a single source, and the visualization piece that I talked about. Self-service was one of the main things. We didn't want it to be, a heavily IS dependent or information technology dependent. It should be a more self-service thing. And we moved away from the push methodology to the pull methodology, which is, I create the report, I send it to 100 people, that's it, I'm done. No, now we are asking some, you come and look at it so that we can, look at, say, did you look at it? Did you look at it? Why you didn't look at it? You didn't like it? Or how do we improve on that? And you spent about 15 minutes, you spent about 5 minutes. Why? He just went in there and looked at this, 2 seconds, he's out. So we are measuring that whole thing to be able to see what's going on there. Collaboration with the service lines, which is very important. Consolidation. So that's one of the things. We become the victim of our own good. So we build the analytics things, seeing our success and seeing our value. Everybody came into us and say, can you take responsibility of this? Can you take the responsibility of this? So that's, again, part of the whole thing. And the cultural change around the data discovery and the decision making based on the data. Those are basically the transformational success. And then the little claim for the fame. In 2017, we got the global recognition for the best-in-class analytics by Gartner, which was huge. And thanks to the team and also the folks at Gartner to recognize that. And key takeaways: know your data, right? That's very, very important. Validate your data to make sure that's the right data that you wanted to look at, right? And then analyze your data. That's basically it. It's as simple as that. What it leads to is basically to tell the story, because most of the executives, they rely on 10 to 15% of the data, but 80 to 85% of storytelling. So that's going to be very, very important for them. And then make the decisions, make the right decisions, relevant decisions, and identify the process improvements, right? So those are the main things. Without all the stuff, right, what is it? What is it? So you are another person just with the opinion. So that basically brings to the end. If there are any questions, I'll be happy to entertain and answer those. Sorry, I was running a little fast in the interest of time.
I'm the default guy to ask questions. First of all, just wanted to thank you for that. That was wonderful. The reason why I came to you initially for this talk was, as I told you, and I just want to say this to the audience, is last year, sitting at home, just surfing the net, I happened to I was looking at the Gartner reports, and I saw that award for BayCare. Then I went back and I started to look at what you all had done. And there was a Deloitte presentation, because you all used the Oracle database for some of your work when you created your data warehouse and things of that nature. And then I had also seen a presentation that you or one of your colleagues had put together in terms of how you all were using the data in terms of best practices and really scoring all the physicians across the whole system. That's the reason I really, really wanted him to come and present today. Thank you so much.
No problem.
Great presentation.
Appreciate it.
The thing that I want you all to be thinking about is, you talked about effective business intelligence. I want you to take it to the next step in terms of eventually going to artificial intelligence, so you can monitor all the devices I'm wearing, and you can tell me, hey, it's time for you to go to the hospital. Very similar to proactive management or maintenance of vehicles and things of that nature. That's where you need to go next.
No, that's very good. Thanks for bringing it up. I had a slide I had to take it off, but that's on our roadmap. So we did all the stuff based on the data, what we have what we are looking at in the discrete form. But most of the data, most of the information about the patients are in the darker data, which we call that as the unstructured data. So we are in the journey of getting into it, and basically that's going to lead us to the machine learning in the next couple of years, and basically that's putting us in a better position for AI. And if you haven't followed the media, day before yesterday, Apple and BayCare joint venture on the innovation thing. So basically your Apple phone will have your medical records. So if you go and use your health app, and you can sign up with the Apple and sign in with your patient portal information, basically health information will be exchanged from your clinical systems to your health app, and the health app to the clinical systems. So you basically carry your own health record wherever you go. So that's first step towards that. And we are looking into a lot of IoT monitoring and bringing that information. That's where I was talking about getting into the big data. Machine learning is in our pipeline. That's that we are working on. Thanks for the heads up on that. Appreciate it. Sure. Any other questions?
Yeah, I have a question. Here, right here.
Sorry.
My name is Kunal Jain, and I am into healthcare IT field for last 15 years. I have a very small story to share with you about my relationship with BayCare. We work with physicians in local area, and there are physicians who go to BayCare and they need the patient demographics information. Now, 10 years ago, we were working on HL7. And it was so easy for us to just connect, make few phone calls, and get the data from BayCare system. Since past 2 years, I've been trying to do it, and we could not get it.
Yep.
And it's not the hurdle that technology is not available, but we as like vendors or technology kind of integrators, we feel the technology has grown big, but it is not available to common people. And what's the reason? It's just a bureaucratic thing, or there are a lot of, it's just not available to us.
So to kind of rewind back on this, very important point, because it's in the media that we are talking about your privacy, and what's the liability for the healthcare and everything else. 3 years back, if you look at this, we did not have a business unit called Chief Information Security Officer, right? Now we do. There's a reason for that, right? It's not the technology which is the which is the roadblock, but again, we have to take the organizational responsibility about the information of our patients, our physicians. So it's not a technology problem. We can just give you the data what you want in any different channels you need. But the problem is that we are looking at and scrutinizing every entity that's looking at our information. We wanted to make sure they are that information is the right hands. So we are taking it through the security validation process, and who's taking the full risk liability and everything else. That's the reason it's taking a little longer. And those could be the roadblocks.
Oh, it's really exciting, Kunal. When you see who our next speaker is, we'll have this conversation.
Perfect.
I was only allowed to take
That's
two
perfect.
questions. Can we
All right.
thank Dr.
No problem. Thank you.